We took him to a psychiatrist, and within a matter of minutes, yeah, she's ADHD, and here's your drug.
Went on the Medicaid, and 5 minutes later, he was on Zyprexa.
He saw the psychiatrist who prescribed the medicine for 20 minutes.
The guy didn't even look at her. He talked to her a little bit. Now, how can you tell if somebody's ADHD or not ADHD from just a few minutes talking to her?
Next thing I know, I'm getting handed a handful of Xanax. That's how easy it is to get these drugs. Just so easy. It was just passed to me like candy. That simple.
If a person were to walk in off the street, sit down with a psychiatrist, the chances of him being prescribed a drug before he were to leave the office, I would have to put it at 100%.
Psychiatrists prescribe drugs. They might have different ways of diagnosing, they might have different ways of interacting with a patient, but it's rare to find a psychiatrist that uses no drugs.
The psychiatrists today are, in quotes, admitting they can't cure these mental illnesses, and they're therefore going to manage your illness by using a drug.
50 years ago, a person who was going through a divorce would have relied on family, friends, clergy, and even the family doctor to a certain extent for conversation to work through the issue. They certainly wouldn't have been medicated.
那是在精神科药物世代之前，当时精神科医师是医界的最低层，几乎只在精神病院工作。由于没有治愈任何人，他们几乎不受到大众尊敬，也不被同业认为是真正的医师。
Psychiatrists had for years been on the fringe of medicine. Typically, the standard doctor internist would have very low regard for psychiatrists because it was understood not to be a very clear science or art.
Psychiatrists wanted to be viewed as physicians, as doctors, and in order to be viewed as physicians and doctors, the people they dealt with had to be viewed as patients. And if doctors dealt with diseases, then their patients had to be diseased.
Psychiatrists had a wonderful opportunity, they felt, to become respected in the eyes of their peers. They raced to create a whole diagnostic book called the DSM, the Diagnostic and Statistical Manual, which was created by consensus.
A group of psychologists and psychiatrists get together, and if they have made common observations, they have a vote and they now classify a new disease. And they give it a number and it graduates into the DSM classification.
And it's a dangerous book. It's a book that has many disorders that could apply to any one of us because the disorders are not real medical diseases. And it's things that apply to nearly all of us at times. Are you afraid of meeting new people? Are you afraid to speak in front of a large crowd of people? Does it make you nervous to go and to talk to your boss about a complaint?
You can invent a mental disorder based on a checklist of symptoms, and that is exactly how the Diagnostic and Statistical Manual, the billing Bible for psychiatry, works.
1952年 DSM 第一版问世之后，病名数量稳定成长。从130页的小册子列出106种所谓的心理失调，到目前 DSM 已经增加到886页的巨册了。唯有透过使用这本书，精神科医师才可以诊断、给药及要求给付。事实上，精神科目前使用 DSM 收取了私人和政府保费达720亿美元。
The DSM is used to diagnose and then give a label, and the label is used for billing purposes. That's how they get paid.
You have to have a term in the Diagnostic and Statistical Manual in order to then call it a disease and treat it as a disease and write a prescription for it.
And so because they can vote it in, they can create, and then the drug industry can just take over and market their drugs for those new disorders.
And those drugs were welcomed by psychiatry leaders because it made us real doctors.
Of course, first the public had to believe that there was something wrong with them, and that that thing wrong was biochemical, and that that could then be treated by a drug which was supposed to cure all.
And so it was relatively easy, I think, to say, well, look, let's start looking at mental illness as fundamentally a matter of chemical imbalance in the brain.
Chemical imbalance is a term that's used as a marketing ploy, as opposed to anything that there's scientific evidence to support.
Nobody has yet measured, demonstrated, or created a test to show that somebody has a chemical imbalance in their brain. Period.
How do you market a drug that restores the chemical balance or corrects a chemical imbalance? How can you do that in good conscience if you don't even know what one is?
The whole myth of the chemical imbalance was created to sell drugs.
尽管精神科医师和药商使用这种迷思赚取了数十亿美金，把大量精神科药物倒进毫无防备的消费者身体里，然而大众却付出最大的代价。据估计，自杀的美国人有半数服用精神科药物。据估计，每年因为精神科药物致死的人数，比因为谋杀致死的人数还多2.5倍。谁该保护大众，使其免于精神科药物的危害呢？在美国食品药物管理局 FDA， 该局的精神科药物咨询小组是由精神科医师所操控，他们来往于药厂、学术界、私人诊所和政府之间，也就是所谓的旋转门。
The revolving door at FDA is one of the primary reasons why the system that we have works so poorly. That revolving door is a direct result of the fact that a group of people with the same mindset are put into positions of being regulators and in the position of being formulators and sellers and marketers.
The panels that are formed by the FDA to evaluate these drugs, the psychiatrists who are on those panels, almost all of them have conflicts of interest where they have directly or indirectly received funding from the very industry and the very parties within the industry whose drugs they are evaluating.
So there's this tight little relationship between psychiatry, pharmaceutical industry, and FDA where they each mutually support each other, and yet the mental health of the population does not improve.
例如 FDA 药物评估小组批准抗忧郁剂克优果，小组中的每一位精神科医师都与药厂有利益输送。这些利益冲突已经猖獗到美国国会要介入调查。
When I check these advisory committees who make recommendations to the FDA, and they're always approved after the advisory committee, I found that there were conflicts of interest. I found that many of the people on the advisory committees had never filed a proper report on stocks and bonds that they owned that might be viewed as a conflict of interest, and they're by law supposed to do that.
精神病学、药厂和 FDA 之间的利益冲突，在1992年处方用药使用者付费法通过后更加严重。因为这个法案 ，FDA 会从每种药物收到10万美金，以确定精神科药物会快速通过核准程序，比之前更快交到每位开药人的手中。
Congress told the FDA, your job is no longer to make sure drugs are squeaky clean safe before they get out on the market. Your job now is to hurry up and get new drugs on the market faster.
It acted to set the priorities of the FDA so that if there was a fee paid for a particular drug approval, it could be put on the fast track and rushed to market with less than the usual scrutiny that the FDA would give it.
这条捷径使得药物安全性被销售所牺牲。处方用药使用者付费法通过后，药物评估的时间从1992年的2年期间到4年之后只需要6个月期间，同时新药物发行的数量也成长1倍。尽管这条捷径对公众安全造成危害，但是它为精神科和制药业带来大笔的财富。新药越快核准，就越快可以赚钱，而且金额相当庞大。平均一种药物的总收入每天超过770万美金。 Zyprexa 金普萨这种药物每天大约赚进1200万美金，即使 FDA 现在对于每种新药的申请变成要收取100万美金，然而这条制药捷径却丝毫没有改变的趋势。
If you look at the relationship between the FDA, the pharmaceutical industry, and the psychiatrists, there's some kind of game that they're playing there. And what is the game? Well, you could say it's money, definitely money.
And when you follow the money, you realize that there is no money in health. There's big money in disease.
That's why all you hear about is managing disease or treating disease. You don't really talk about curing disease.
And so psychiatrists have become mainstream doctors in America, and that is because of the pharmaceutical industry. They can thank the pharmaceutical industry because they become mainstream and because they have a lot more money than they used to. And the drug industry can thank them because now they have thousands of soldiers in their army distributing these drugs to everybody.
从最小的婴儿到最年长的老人，没有人可以免于精神科医师发明的数百种失调症。这些失调症更活络了数十亿美金的精神科药物工业。每天，精神科医师把他们的网撒得更广。这需要什么呢？另一种精神病标签